Blepharoplasty. Blepharoplasty. I know, we love big words, we love Latin words in medicine because it makes us feel important. But it's an eyelid tuck, just the same as a tummy tuck, neck tuck, butt tuck. They're all tightening, getting rid of excess skin and fat, and tightening the appearance of the eyelid. So the upper eyelids, if you notice, you look at when you start to get excess skin in the upper eyelids, you have an extra hang of skin that hangs over your eyelid. Sometimes you can't even see your eyelid, and in really severe cases, it can be so heavy that it makes it hard to open your eyes, or your eyes get tired very easily, and you're squinting. So it can be a serious medical problem, but it can also be a serious cosmetic problem too. That's upper eyelid blepharoplasty. In those situations, we just take out the excess skin, and all of a sudden you can see the eyelids again. Sometimes the problem is the eyebrows are so heavy, they're pulling everything down, and then you really have to do a brow lift where you lift up the skin above the brow, and then everything's fine. So these procedures have been around for a long time, but why are they suddenly so popular? Well, when I was in training many moons ago, we did these under general anesthesia in the operating room, and with the full prep and the full regalia and everything. And now I don't know a single surgeon who does blepharoplasties in the operating room. I would probably say 95% of plastic surgeons do them in the office. They do them under local, so you don't have to go to sleep. It drops the price, so the cost is not as prohibitive. The recovery is about the same. You're black and blue for a couple of days. Third day, you're out moving around with sunglasses in the week. You just look younger. And people are like, oh, did you do your hair? It's hard to tell what really happened. But it's a very innocuous procedure under local. And then, what that also does is it can be done in high-risk patients. So previously, patients who had previous heart disease or lung disease, smokers, who we wouldn't touch in the operating room, under local, you can do them. You can do 90-year-old men and women who request it without worrying about all the things you worry about when you have to put a patient to sleep. So it's more accessible. It's accessible to more people, even people with medical problems. And it's a safe and short, quick procedure with a very, very short recovery. Baby boomers are have gotten to the age where they have the problem. So now you have a wider segment of the population that has the problem, and then you combine that with technology that's allowed us to do it safer, easier, with less downtime in an office setting, and then it's no surprise that the numbers are going to jump.